So fracture of the upper limb is will okay. Today we are classic fracture of clavicle. Mainly that fracture will happen clavicle bone. So if you're doing sports and wearing bags and all, it will be happen. So local pain, tenderness, and patient support with the affected limb to other end. So head for one side, it will be gone. So treatment is reduction and figure eight, that 8 shaped bandage. Now a complication means maybe it's a non-union. Maybe they won't join. Okay. So indication of the operative treatment for non-union neurovascular involvement, unstable fracture of the lateral end near the acromyoclavicular joint, and for adult, the persistent wide separation of the fragment, interposition and soft tissue and floating shoulder. So I'm telling that symptoms all line by line is there. Okay, non-union, so neurovascular, unstable, then persistent separation of the fragments. So this is that image is showing. Okay, so fracture of the scapula, usually no displacement, supported by the muscles on both side. So arm siling. Then indication of operative treatment is floating shoulder and major displaced, okay, juvenile fracture. So this is for the floating shoulder. Okay, next for the displaced juvenile fracture. So that fracture is, you can see that x-ray picture. Okay, then fracturous humerus. Humerus means proximal humerus. It's a surgical greater tuberosities and shaft and distal humerus and supracandicular and intracandicular for the epicondylosis. Then for surgical neck treatment, impacted strapping, displaced reductions, then strapping, surgical reduction with the flexion with K-wire and plate, screw and intramedullary interlocking nail. So this is the surgical procedures they will do. Shaft humerus means you can see that broke. Okay, so they will do for transfers for conservative and unstable obliqual communicated interlocking and the plate of skewer malleable and medullary lines they will do. So this is intrafections for humerus. So intra that plate they will place. So this is different method. Okay, the three surgical procedure they will do. Most important complication is for radial manu. So radial side we can many times our wrist it will get for spine, that one. Okay, then supracondylar fracture means it's common for children, extension flexion types. So pain, swelling, ecchymosis will be there. Treatment for urgent reduction of the post slap and in unstable of a permanent virus, open reduction of the intrafracture with wires. Then same plate and screw they will place. So complication is malunion, then cubitus vercus and cubital valgus joints for attenuation and malunion. So image you can see and understand. Okay, then another thing, vascular complication means acute ischemia due to vascular injuries, edema and tight cost. Management is management of acute ischemia means urgent reduction of the release and tight case bandage, systemic vasodilator and no improvement of surgical exploration. So Welcomen ischemia contracture. So that is the what means you can see that normally some genetically they will happen na? So genetically their hand like this will be there na? So that is fibrous and deep forearm muscles due to prolonged ischemia. Then surgical actions of fibrous muscles and tendon operations. Then intracondylar fracture means TRY shaped. Then intra-articular affecting the joint surfaces. Treatment for open reduction for internal flexions to restore and smooth articular surfaces. So humeral condylosis means avulsion of the mid or lateral, then common for children. So that ORF they will do. So fracture of head radius means it intra-articular fracture. It's treatment for large fragment and committed for extensions. Then arthroplasty they will do. Last class I arthroplasty I explained. Okay, so this is for olorocrinon. So this for ORF they will do and banded wiring they will do. Then plate flexion they will do. So simply this upper what are the treatment and what are the joints they will using only you can learn. Okay, so fracture dislocations, so extension type, flexion type and lateral type treatment. all cases, most of ORF they will do treatment, surgery treatment. Okay, so Galecia fracture means this is the see. So this is for V type bone. It will be for one side they broke displaced. So this is fracture for distal third of the shaft and radicus dislocation of the distal radicular joint. So this is open reduction and internal flexion of the radicular fracture. So fracture of the both bones forearm. So it's usually green stick injuries. So treatment please closed reduction and above elbow cause frictions. So treatment conservative and closed reduction and plaster frictions. So complication malunion and cross union. So see image, then Colles fracture. This is like they will ask, okay, so normal time. Colles fracture means what? Like this, they will ask. So this is for the distal 1 inch of the radius. So with or without ovulation, that ulnar styloid. So it's common for old age due to osteoporosis. Then displacement of the distal fragment. So backward, upward, and lateral, they will place clinical pain, tenderness, and dinner fork deformity. So that stick noodle stick is there in a spoon, they will like this only. So treatment means they will do for closed reduction, plaster fractions, and committed with the intra-articular extension of the forearm and complication malunion, rupture of the EBL tendon, then atrophy. So fracture of the scapular. Scapular means it's a maybe impacted, not evident to yearly X-ray. It's a clinical max tenderness and snowbox. So image you can see immobilization. So scapular and collus, then stuck atrophia. This three thing I will give to the as a. So fracture of metacarpals means close reduction, corrective deformity, and plaster fixations. So Bennett fracture. Bennett fracture means it's metacarpal extending into the carbo-metacarpal joint, usually needs for IVF and KP wire. So this is the normal upper extremities causes. Mainly if you are asking fracture cases, swelling will be there, tenderness will be there, and shock will be there. The surgery treatment ORF and K wire and plate. So if you are asking exam, you can write like this only. In this is for symptoms, this is for treatment and surgical treatment mainly. Then 8 bandages. If your shoulder asking, they you can put for 8 bandages. If normally asking, you can put for normal bandage recover. Then a POP you can mention for POP. That's all. Okay. Thank you guys. If any doubt, just call me personally. I will clarify this one. Okay.